The consequences of limiting knowledge and access to alternative medicines can be detrimental to the general public in several ways. Firstly, restricting information about alternative therapies limits individuals' options for addressing their medical needs comprehensively. According to a report by the National Center for Complementary and Integrative Health, over 30% of adults in the United States use complementary or alternative medicine for various health conditions, indicating a substantial demand for diverse treatment options. Many alternative medicines offer holistic and personalized approaches that may be more suitable or effective for certain individuals, especially in cases where conventional treatments have limitations or side effects. Secondly, the monopolization of healthcare by mainstream pharmaceuticals can lead to exorbitant costs for essential medications. The World Health Organization reports that high drug prices contribute significantly to the global healthcare cost burden, affecting accessibility and affordability for individuals and healthcare systems worldwide. The vast size of the global pharmaceutical market, which is valued at $1.27 trillion as of 2020, can certainly act as a potent incentive for business interests to potentially manipulate skepticism towards alternative medicinal offerings. This manipulation may take the form of efforts to discredit or malign alternative medicine, and its burgeoning popularity and efficacy could pose a competitive threat to the growth and hegemony of the mainstream pharmaceutical industry. One example of this is detailed in the Washington Post article, How Drug Company Money is Undermining Science. The investigation delved into the influence of pharmaceutical companies on medical research and public perception, revealing instances where these companies funded skeptic groups to oppose alternative medicine practices.
I am Susan Gerbic, and I am a skeptical activist.
The article shed light on how these skeptic groups aligned with pharmaceutical interests actively campaigned against alternative therapies that might rival mainstream pharmaceutical products. This revelation underscores the intricate relationship between business interests, skepticism towards alternative medicine, and the strategic imperatives of the pharmaceutical industry. Similarly, a study published in the Journal of General Internal Medicine in 2016 revealed evidence of bias in medical research funded by pharmaceutical companies. The research indicated that studies backed by these companies were more inclined to favor conventional medical treatments over alternative therapies, reflecting potential influence on research outcomes.
It is essential that decisions are not just made by those who show up in the room. You have to be intentional about bringing all the voices in. When Wikipedia first started, the majority of its authors were Western white men, which led to some really significant biases and gaps.
The limitations and restrictions placed on healthcare options, as discussed earlier, are particularly detrimental when considering indigenous traditional medicine. Despite the documented effectiveness of traditional indigenous healing methods, these practices are often marginalized and underutilized within conventional healthcare systems. This neglect not only limits treatment options, but also perpetuates health disparities and hampers an individual's ability to access culturally appropriate and effective care. The disparity in acknowledging and practicing indigenous medicine within conventional medical care settings highlights a broader issue of limiting access to diverse treatment modalities. The exclusion of traditional indigenous medicine not only restricts individuals' choices, but also perpetuates a power differential favoring conventional care, as discussed in the Lancet article urging support for indigenous rights in health practices. Furthermore, the lack of formal policy frameworks and national adoption of indigenous health policies exacerbates this issue, leading to a significant gap in understanding and integrating traditional healing methods into healthcare delivery. This gap is particularly concerning given the pressing health issues faced by indigenous communities such as substance abuse and addictions, where traditional medicine has shown promise in addressing these challenges. In essence, the restrictions on healthcare options not only limit access to beneficial treatments like traditional indigenous medicine, but also contribute to ongoing health disparities and hinder progress toward culturally competent and inclusive healthcare delivery. Bridging this gap requires a comprehensive approach that recognizes and values the contributions of indigenous medicine while promoting informed decision-making and autonomy in healthcare choices for all individuals.